little red button that says recording. It's pulsating.
Yeah, I think I am recording. All right. Awesome. Welcome, everyone. Before we get started, this session is being interpreted into Spanish. To listen to the Spanish audio, locate the globe-shaped icon at the bottom of your Zoom toolbar. Click on the icon and select Spanish from the menu. Let's go to the next slide. Likewise, if you would like to view the Spanish slide deck of this presentation at the top of your screen, there is a tab labeled View Options. Click on that tab. A drop-down menu will appear where you can select which deck you would like to view. Next slide. All right, our presentation today is going to focus on MCN's Health Network program, a care coordination program for patients who move during treatment. My name is Martha Alvarado. I'm the manager of online education for MCN. Presenting today is Dr. Laszlo Medeiros as Chief Medical Officer for Migrant Clinicians Network. Dr. Medeiros is responsible for the oversight of MCN clinical activities. He also serves as subject matter expert for various topics in migrant and immigrant health, including COVID-19. Over the past 30 years, in parts of Africa, Central America, South America, the Pacific Islands, and the United States, Dr. Medeiros has served thousands of individuals for wide-ranging ailments, including newly emerging diseases. It's always great to do this presentation with you, Laz, so I'm just going to go ahead and let you take it away.
Okay, very good. Thank you, Martha. Hello, everybody. Good afternoon. I'm in South Central Pennsylvania here with the lovely fall weather. Thank you, everybody, for participating. I am a family physician based in South Central Pennsylvania, and I've been the Chief Medical Officer for Migrant Clinicians Network for about 7 years now. I'm here with Elizabeth Gonzalez Ibarra, who's going to be speaking also today about Migrant Clinicians Network and specifically about our health network programs. So before I started as the Chief Medical Officer for Migrant Clinicians Network, I was a family physician based in a federally qualified health center in Chambersburg, Pennsylvania. And I also worked with farm workers in the Gettysburg area. And I had patients who moved from place to place. Sometimes they came up from Virginia and the Carolinas. They worked with us in Gettysburg for a few weeks, and then they moved on with the apple harvest up further north. And as I was taking care of my patients, I noticed that some of them had chronic health issues that really required more than I could just give them in a few days or a few weeks. And so I was happy to learn from one of my partners, Dr. Ed Zerwesti, who was the founding medical director of MCN, that we had a program that could help take care of patients who are on the move and who left my services in Pennsylvania to go elsewhere. And this was MCN's health network. So I became involved in this early on. And for the last 7 years or so now, I have been the chief medical officer for MCN. So who are we? So Migrant Clinicians Network, MCN, is a care coordination program for patients who are on the move during treatment. Next slide. So our mission is to create practical solutions at the intersection of vulnerability, migration, and health. We envision a world based on health justice and equity, where migration is never an impediment to well-being. And this is one of our doctors, Dr. Ed Zerwesti there, pictured. He's their founding director, as I said. We are a force for health justice, and we do many different programs. I'll focus on Health Network, but I want to just show you some of the other things that we do. Next slide, please. So some of our work includes resource development, education, technical assistance. You see some of our health network associates in that picture, technical assistants. We do some research. We help with worker health and safety. Some of our farm worker health programs include talking about heat stroke, pesticide exposure, et cetera, for farm worker safety. We do psychological support for providers, clinicians, who have had great difficulties and challenges working with populations who are vulnerable and sometimes need some help of their own. This was particularly helpful during the COVID pandemic, where many clinicians, including myself, really benefited from our Witness to Witness program. So, psychological support is another important aspect of what we do. We do evaluations, and at the end of this talk, we would like to have your evaluation as well. And Martha will let you know how to do that. We always want to make sure that what we present is useful and helpful. And if we can do better, we certainly want to know how to do that with your suggestions. We also do advocacy. We speak with politicians to see if we can help our clientele get better understood, better healthcare, better notice as to rules and regulations that abound in the United States. And we do peer networking. I'm a clinician myself. I've experienced a lot of the same things that many other clinicians across the United States have experienced, and we're happy to help there in peer-to-peer. And we are a bridge to case management. And that's what I'll talk about next. So where are we from? We are in various parts of the United States. We start off, our main area was Austin, Texas, where the first Migrant Clinicians Network formed an association. We are in Chico, California, and Salisbury, Maryland, where we do a lot of our farm worker safety. We also have many different areas where our health network associates live. I myself in the area around Greencastle, Pennsylvania. We have so many different places around the country that we are very adept at using Zoom and other social platforms. So we are an organization that is widespread. In the last several years, we also had very important programs in San Juan, Puerto Rico, and we continue to become larger and larger in our scope. Next slide, please. So who are our constituents? So we can divide these into larger categories: underserved migrants and immigrants, clinicians, migrant and community health centers, state and local health departments. One of the other things that I do is I work at the Pennsylvania State Health Department for tuberculosis control. And so whenever my patients travel from one part of the country to another or internationally, if we need to continue treating them for tuberculosis, those medications are supplied and the patients are followed and helped as they move from place to place. But our primary constituents are primary care providers, community health workers, nurses, dentists, social workers, outreach workers, public health professionals, health educators, and medical assistants. So we try, these are all our constituents, and we try to work as a team with them to get the care for our patients that is needed. Next slide. Okay, so MCN's Health Network, this is the program I'll be talking about more specifically now. It has been established many years ago, and the efforts were to eliminate health disparities due to patient mobility, originally with tuberculosis, but then other ailments as well. But we don't want to have any disparity of health based on patients' mobility, moving from place to place within the United States and also internationally. Next slide, please. So over the years, Health Network has had many years of experience in doing what we do, and we're celebrating over 28 years of innovation. MCN has actually been around for a little bit longer than that, but what we do in Health Network has been around now for almost getting to 30 years with lots and lots of experience with many different peoples around the world. Next slide. It is important to note that MCN's Health Network does not discriminate on the basis of immigration status and will not share personal patient information without patient permission. We try to respect everybody, and we understand that there is some hesitancy to agree to be followed and worked with as people move from place to place. And there's a concern that information may be shared, but we do not share information of the patient's personal information without any permission. Next slide. It's very important also to know that confidentiality is critical to all MCN staff, and all health network procedures conform to HIPAA standards. So the Health Protection Act of 1996 applies here. We make sure that all patients, once they sign or have a witness sign a consent form before their health enrollment in Health Network, will get the confidential treatment that patients require, just as if they were medical patients in a hospital or in any other clinic. So confidentiality is very important to us, and we will have everybody sign for a consent form. And if you have a child underage, then we have a parent or another witness sign for that person. Next slide. I want to go over briefly the forms that are required for enrollment. If you see here, this is the general form that we have on our website. This can be downloaded. This is to just say that we will take care of the information, the medical information, sensitive information, and we will not share it. We also want a signature to say that you understand this as a client of ours, and that we will only share information if you give us permission to do so. Next slide. So the form has several places where we request several different things, including a signature for participation. And the signature is very important. It gives MCN staff legal permission to transfer participants' medical records and contact participants. I think you can hit the next slide button because I think this comes up. There we go. Yeah. And it's valid if given within 5 business days of being signed by the patient, and remains valid for 24 months from the date signed. Participants may renew their consent after it expires if they still need assistance. Next slide. Okay, so we give information on the videos that we have that inform us about Health Network. You could also, as I said, download the enrollment packets in English, Haitian Creole, Portuguese, and Spanish. So these are enrollment resources that are available at that website, www. Migrant Clinicians Organization Health Network Enrollment. Next slide. So we also request a business associates agreement with the clinics, the people who enroll their patients, so that their medical records can be shared and move from one place to another. So we will try to update records as patients move from one place to another. And this is also HIPAA compliant. Next slide. So a recap of what Health Network enrollment criteria are. 1, the patient is either mobile or a migrant or thinking of leaving the area of care. Now, at the time that I work in Gettysburg, for example, I try to enroll my patients, and I learned early on that it was important to try to enroll them early on as they were thinking of leaving care. Sometimes when I was very early in my career, I would wait till the last appointment and try to enroll them then. But it turned out that they may have missed their last appointment because they were already on their way to their next assignment, the next farm, the next place to be picking apples or fruit. And they would not keep their last appointment, and I'd lose the opportunity to get their phone number and their records. This is something that's really going to be important. If you find that the patient is going to be or just thinking of leaving, then try to get all the information early on. That way, our health network associates can call early and establish good rapport. And the more times that we establish care with them, the more likely it is that they'll continue to follow with us as they move from place to place. The second criteria is that the patient needs some kind of medical condition that needs clinical follow-up. And we need to have at least one, and hopefully more than one, working phone number with the patient themselves or a family member with a phone number. We call this person the anchor. We also, as I said, need the signed MCN consent form. And often we need a clinical base or enrolling clinic. But as we work on the border more and more over the years, we realize that some places there aren't standing clinics. And so a respite center or a center for migration, sometimes these are sufficient to have the clinical base for enrollment without actually having a true federal qualified health center there. Next slide, please. So steps in maintaining patient care. So what is it that we need to have it successful? So on our part with MCN's Health Network Associates, so some of the things that we do, we can go on to the next slide. So we contact patients on a scheduled basis. The Health Network Associate also contacts clinics monthly. Other healthcare clinics receive updates as requested and when treatment has completed. This varies sometimes more often for patients who are pregnant, for example, who are in their last trimester. We contact them a little bit more often than somebody who has tuberculosis, for example, and needs maybe every 4 to 6 weeks contact. We also assist patients in locating clinics for services and resources. So we do have some resources, but unfortunately, we cannot provide any type of transport. But we do try to connect our patients to care managers and social workers locally, who are the local experts at knowing what kind of services and transportation is available. And then our health network associates report back to the enrolling clinic and notify them of the final outcomes. And as a clinician myself, I found this very helpful. So if I sent one of my patients to Migrant Clinicians Network, I would like to know what they had, what was their outcome. And so if it was tuberculosis and they got their treatment as they left my area of the United States, it was good to know at the very end that they got their treatment completed, because many times they would come back seasonally, and next year I would know that, yes, indeed, they finished their treatment. Or in case of a pregnant patient that I got to see for a few weeks, and they went further north to New York State, and they delivered their baby there, the clinic would tell me that they had a healthy delivery, and next year I could congratulate them as they come back to my area of Pennsylvania. So it was very important for me to get information that the treatments that I started, were successful, and that my patients were completing their treatment as needed. So this is one of the other great things that Migrant Clinicians Network, Health Network Associates do. Next slide. So I talked about the role of the Migrant Clinicians Health Network Association, and our associates have certain requirements, but what is the patient's role? So the patient themselves, really, their most important thing is to give us as many phone numbers as possible so that we can continue to care for them. If one number is no longer useful because they crossed international country lines, then the next number we would try, and the more we have, the better. So this is one of the things that we like our patients to do, is to provide as many phone numbers as possible. Next slide. We also want to inform them, or we want them to inform the Health Network associates of any phone or address changes and contact Health Network staff after arriving in a new area. This is to ensure that if we need to send updated medical records from their previous area into their new accepting area, that we have all the updated information and send it to the correct place. If phone numbers or addresses change, or they change their target area to arrive, then we change and send it to the places that they change to. So this way we keep everything up to date, and it's really important, because if this doesn't happen, we do lose contact with some people, and then we don't have any means to reestablish care. Next slide. It's important also, if you're taking medication and you're on the move, to please continue treatment as long as indicated by the physician. So if your physician recommends that you continue taking, say, medications for tuberculosis, diabetes, HIV, etc., then it's really important to continue those as you move from one health center to another, across state lines or across international lines. And we try to make sure that the sending clinic sends also sufficient medications, so that by the time they reach their receiving clinic, that they haven't run out of medications entirely. Next slide, please. So over the years doing this kind of work, we have had more than 15,100 total Health Network enrollments. These are patients that registered with Health Network and that needed some kind of health care. So we have had great international success, and also great success in the United States as people are on the move. You can see from this map the green dots. You can see a lot of them in the United States. You see some in Europe, Asia, South America, Africa. In total, we had over 3,000 total clinics in the US, and over 114 countries engaged to eliminate mobility as an obstacle to continuity of care. So, and we have our Health Network associates very dedicated. Sometimes they come in early to account for the time zone changes, and to make sure that wherever they're calling, it's within the business hours, the working hours of that particular time zone, no matter where it is across the world. So sometimes they come in early, sometimes they stay late to accommodate the various different time zones around the world. So next, I'll talk about tuberculosis as an example of a successful program that we have had for many years. Next slide. Oh, you're good right there. Thank you. So Health Network program began initially as TB-Net. This was started by clinicians who saw their patients move across back and forth from Mexico to Texas for work and visiting family, etc. They needed to have continuity of care, because tuberculosis was one of these diseases that require often 6 months, 9 months of continual treatment without any interruption. Interruption makes it possible for there to be tuberculosis resistance. So this is a very important TB-Net that started off, and I'll show you some of the successes that we've had here. So over the many decades that we've been treating tuberculosis, we've had 2,125 treatment recommendations for patients who are enrolled. 26 of these are MDR, which is multi-drug resistant tuberculosis. 65 were resistant to at least one drug. 37, unfortunately, were deceased. A few of these were deceased because of tuberculosis, but unfortunately, several of them were deported to their home countries where there was a lot of political violence, and some of them had deaths that are attributed to homicide and political killings rather than tuberculosis deaths. So those 37 deceased, unfortunately, include many that should not have been sent back to their home countries because of the violence that was there. Next slide. So, of the ones that were recommended and followed, 2,088 were followed for active tuberculosis. And this is very serious. This requires usually 4 medications given for at least 6 months, often 9 to 12 months. And of these 2,088, 211 were lost to follow up, and 106 refused treatment for various different reasons. So in total, we had 1,771 complete treatment. Next slide. So 1,771 patients completed treatment over time. And these are patients who are mobile, moving from place to place. And given the total and the number that actually completed, that was 84.8. So almost 85% completed treatment despite moving from place to place. And if you compare this to the national population of the United States who get treated for tuberculosis who are not moving from place to place, that they're stationary for the entire time, it's about 86 to 87%. And so 84.8% is quite good. And based on this success, we actually went ahead and developed not just TB Net and our tuberculosis network, but we started with other illnesses as well, such as diabetes and HIV, and also pregnancy and general health. So I'll go over a little bit of that as well. But this is the success of our original program, which was based in treating tuberculosis on the move. Next slide. So I'm going to talk a little bit about another disease process, which is diabetes. I'm going to talk to you.
Can I interrupt you for just 1 second, Lance?
Yes.
Yes, excuse me, sorry. It looks like we lost a slide there with the breakdown of the different ailments that Health Network treats. So I'm just going to continue forward if you don't mind.
Sure. That's fine. Yeah. Okay, so I'm going to speak now on diabetes. Okay, very good. So I'm going to talk about a patient of ours. It was a real patient, but we're using a pseudonym Fernando, who was a farm worker, a migrant farm worker who had diabetes diagnosed at age 49. He traveled each year from South Texas to Minnesota to say, wherever I can find work, that's is where I'll go. And so we continued to working with him. He was 56 years old at this time, but he had been diagnosed with diabetes earlier. And this is his pattern. So he went back and forth. You can see all the different years that he traveled up and down from Texas to Minnesota, some places in the mid-Atlantic where I was working, down to Louisiana, back and forth. So you can see over these years, over these several different years, that over the time we had over 10 years enrollment, he made 46 clinic contacts. We had 124 patient contacts, transferred medical records 9 times in 6 different clinics. So this is quite complicated. And this is also important in diabetes because if you don't keep your treatment going, you can develop kidney disease, eye disease, neurological diseases. So it's really important to keep your sugar as controlled as possible. So this is another success story, and I just wanted to give you an example of this. Next slide, please. So in the course of his treatment over these 10 years, you could see overall his hemoglobin A1C, which you see on the y-axis. Now, hemoglobin A1C, I'm sure most of you know, this is a marker for how well your diabetes is controlled. Normally, we have this under 6% if you don't have diabetes, and we try to get a target of somewhere between 7 and 8%. So that is our target for well-controlled diabetes. However, when he started out with us, his was up to almost 14%, almost twice what we would hope for. And over time, this came down. You can see that 2004, from 2002 to 2004, it came down significantly. He lost some of his insurance, and we lost touch with him briefly in 2007, so it bumped up again. But then he came back to us, and we got it down quite nicely over the next couple of years. So you can see the overall downward trend down towards 7 to 8. And that's what we'd like to see for well-controlled diabetes. And after a time, he decided he was not going to move anymore. And what happens when we don't have people on the move and they're established already in a qualified health center or with a physician or a state health department, we close that case. And that's part of my job, is to just close the case finally when the patient is no longer on the move. That can be restarted at any time if the patient decides after a couple of years that they're going to be mobile once again. So we have their records based in Austin, Texas, and we can restart their care and their care management if they start to move again. Next. So you can see right there that green line. That green line is where the normal hemoglobin A1C is. Okay, so how can we do such a good job in TB and in diabetes and many other health conditions? Part of this is we have a really great MCN Health Network team, and we have had great completion in 114 countries. And part of this is because we have a multilingual, multicultural case managers who use multiple communication techniques, different platforms. And MCN's case managers speak multiple languages, including English, Spanish, Haitian Creole, French, and Portuguese. And often we use a telephone language service for all the others. You can see some of our health network associates here. And we also have the pleasure of having Elizabeth Gonzalez, one of our health network associates, here with us too. And in just a few minutes, she'll be talking about a particular part of our health network program. But again, we have case managers, very dedicated, multilingual. They have established great rapport with many of our patients as they move from place to place. And in the case of some of the prenatal care that they've helped patients find health centers and hospitals where they deliver the babies. Our clients have actually named their babies after some of our health network associates. So you can see that is, they build quite a strong bond with the health network associates who are case managers, and they're very culturally adept. So I'm very proud to work with the group that does this kind of great work. Next slide. Okay, so we have a breakdown here of all the different kinds of health diagnoses that we work with. I spoke at length about tuberculosis and a little bit about diabetes. We also, over the last couple of years, have had a larger amount of prenatal and infant programs. You can see 28% and 17%. And so almost 47, almost 50% of our cases now are prenatal and infant, ones who are born to our prenatal patients. So we also have COVID vaccine, which was important a couple of years ago as we helped our farm worker populations who are mobile to continue to get their updated COVID vaccinations as well. We have HIV and cancer screening, and then general health. So general health has become quite big as well, 32%. But you can see here that we've expanded quite far now besides tuberculosis and diabetes, which were our original successes. So this was very important. And from all the infant programs that we've had, we've developed a network of clinicians, mostly pediatricians, who help with some of the more serious concerns, health needs, health concerns of our pediatric population as well. Next slide. So at this point, I'm going to turn it over to one of our health network superstars, Elizabeth Gonzalez Ibarra. And she'll talk about the SCAN program, which is what I mentioned just now as a program that helps some of our sickest pediatric patients who may need tertiary care centers to continue care. So, Elizabeth, you are up next here. Thank you very much. We'll have time for questions at the very end.
Thank you, Dr. Laszlo. Hi, everybody. My name is Elizabeth. I'm the SCAN coordinator for Health Network. So SCAN, of course, stands for Specialty Care Access Network. And really, it's a branch of Health Network that helps specifically the patients 18 years or under, the age of 18 years or under. And our primary goal in SCAN is to assist with the coordination of pediatric patients into subspecialty care. You can go to the next slide. So a referral into the SCAN program could be any of you guys, maybe that are listening, or anybody who's from a clinic, a program, an organization, or if one of our SCAN members identifies a patient with subspecialty needs, then they will be referred to the SCAN program. Um, Us Health Network associates can help and guide you and instruct you how to complete the enrollment packet. You can send us an email. Maybe you know somebody in Health Network, get in touch with them, and we'll be glad to help you out with that process. You can go to the next slide. Referral again into our program. Our goal is to have the following information, which is, of course, the patient's information. In this case, it will be a child's information and a signed consent form, which will be signed by the parent, either mother or father, or a parental guide. That they have. And then also a patient care summary, meaning any medical records that you may have for the patient, medical notes, anything of that sort, that will be wanted and very appreciated on Health Network side, just so we know what is happening with the patient, so we can identify also a plan for the patient and how we or I can go about the case and following next steps. So we can go to the next one. So, scan patient coordinator, which is me, I will contact the family to introduce them to the program, and I will complete the patient enrollment if needed. In case there's anything missing on the enrollment packet, I will probably bring that up as I speak to the family. Um, if it's not me talking to them, it'll probably be Alma, our coordinator for Health Network, specifically prenatal care. But she does the first calls mostly, but I always try to make the first call with the family to introduce myself. Um, Care coordination will identify the appropriate scan member. So that is me. I will probably try to identify who would be best to communicate with. Usually, and for the most part, we have somebody in each state, I believe, nationwide. So I will assess where the patient is and coordinate as needed to get any further assistance and provide a short summary of what's going on with the patient so I can get a plan going for them, whether they need to go to a federally qualified health center or a hospital, or how we can try to help them get to the subspecialty care that they need as quickly as possible if it is needed quickly anyway. We can go to the next one. This is going to be an example of how an enrollment happens. So Our example is Letty is a 5-year-old girl born in Guatemala with developmental delay to include speech and toileting. So the child has arrived at a welcome center in Tucson in January 1st of 2021. Um, Her mother speaks Spanish fluently and is literate. The health network associate, or me or anybody else, will talk to the mother about the referral and try to get mother to agree to the referral, or if again, they can always refuse to, and that's totally okay. But I feel like most of the time they do want the help. Um, they don't really they would appreciate all the help that they can get. So for the most part, mom will agree. And mom also told the associate, so she'll probably tell me a little bit about the past. She tells me that the child might have microcephaly and was sent for tests, but mom never took her. So I will take this into consideration, take some notes to be sure that this is addressed in a future health center or with my SCAN members. You can go to the next slide. Mom says that the child has had essentially no health care. So today, the health network associate will complete a EPSDT or a well child evaluation on the child. And with that being said, the physical exam seems normal. The height is at 50 percentile. The weight is at 25 percentile. So the enrolling health network associate will include this EPSDT form and growth chart when records are sent. This meaning I will provide any medical record or physical exam that was done for the child. I will be sure to send that to the next federally qualified health center so they are aware of the most recent visit that they got from I feel for this example, it was probably a midwife that may have done these. I don't think I would be qualified to say that a child is okay or not, but let's say that our pediatrician or a midwife saw them. They gave me these notes. I will be sure to pass them along to the federally qualified health center, along with a couple of notes saying that the child essentially has no speech and uses diapers, so does not toilet at all. We can go to the next slide. So we know now that the family is traveling to California later. So the health network associate has gotten an address, a telephone number of their sponsoring family or any close family that they are going to live with. That is always good to know in case we're unable to reach the mom or whoever the parent is at that moment. Mom has already signed the referral to MCN, so they should follow Health Network Associate instructions and see. In this case, there might be a little typos here, but in this case, meaning the enrolling person should send us documents through a secure email, or they should send us through a secure fax number. So we do ask for those health centers who are referring to us or a clinician in the program or organization to always please send medical records or notes with them if you have them, just so we know what's going on. In this case, I identify that, of course, we're going to need a pediatrician. We're going to need peds neurology, speech therapy, and occupational therapy. I will most likely mention these to my SCAN members and will work diligently and closely to move forward and get them these services as soon as possible as needed. So we can go to the next slide. Who do you send the referral to SCAN? You can send it to me. or you can send it to Health Network or Alma. All of us are always on our emails trying to look through them. I know I am, so I will, if I see a referral come in, I am on it. I will make sure to see if the enrollment is complete and if we have everything we need. If not, you will hear from me and I will ask for whatever is missing. But I hope that nothing is missing and we can move forward smoothly. I will identify then later a SCAN team member to contact, especially or wherever the patient moves to. And then I will continue patient care coordination with any other SCAN team members that I could seek advice from. But my email is there at the bottom. If you have any questions or if you want instructions, I can always help you and guide you through whatever you may need. Next slide. I think I'll pass this on to Martha now.
Yes, to me. Thank you so much, Elizabeth. So I just want to mention that we will be presenting a follow-up webinar to this presentation on how to enroll patients into Health Network. Let me start over. We're going to be presenting a follow-up webinar to this presentation on enrolling patients into the Health Network portal. And you can register by scanning the QR code that you see there in the corner. Or you can check out MCN's upcoming webinars page or watch for a marketing announcement through your email, or you can visit us on our various social media platforms. This particular webinar on Tuesday, November 19th, is going to be presented in English only. Let's go ahead and go to the next slide. And as I mentioned, you can stay connected with MCN by going to our website and accessing our latest resources, get some updates from the field, or register to attend any of our online educational offerings. Stay up to date with MCN by following us on our social media platforms. Next slide. And if you have any questions about Health Network or would like to schedule a training for your health center staff or your health center, please contact Thresia Lyons Clampett at the email address provided on the slide. And if you have questions about enrolling patients in the Health Network, you can contact Alma Colmenero at the email address, and phone number shown on the slide. Next slide. And I want to apologize, forgot to stick the QR code in here. So I'm going to be sending everybody a follow-up email later today. It's going to have the links to the evaluation. So please remember to submit your evaluation. We do pay attention to your evaluation as we use comments you give us to improve our training. So thank you very much for that. And I'm sorry I did not have my camera on. I apologize for that. Let's see here. So let's go ahead and go on to, I think this might be it. Yes, that's the end of the presentation.
We just wanted to give some time also for questions. So for myself, for Elizabeth, or for Martha, if you have any questions, please let us know. I also want to thank our interpreters. I know when I speak, I get really excited sometimes and I speak very quickly, and they have a hard time often to continue with Spanish with me. So thank you very much again for our interpreters. But we gave a little time here for questions. And one of the things I'd like to really emphasize again is that whichever, if you're using SCAN or our health network, whatever it is, it's really important for us to establish contact with the patients. And if you have, these are your patients and you've already established a trusting relationship with them, then that warm handoff is really important so that they know that the person who's going to be calling them from our health network associates is going to be somebody who is kind, compassionate, most likely will know their language. And if they can establish that while they're still under your care before they actually leave your care, that's the time that we find that we have the most success in that continuation of care and care management to the next enrolling health center. If they don't have that trusting relationship, sometimes if they get a call from someone they don't know and they've not been introduced to before, they can be less trusting. Although our health network associates really do a good job in establishing that trust and all that, but any help that you guys can give to get their phone numbers, make sure that we try those phone numbers before they leave your care. That's the best opportunity to establish a strong bond right from the beginning. So I just want to emphasize that at this time. But I want to give some time for questions here.
I don't see any questions that have come in. If you do have a question, just raise your hand. I can take you off mute and let you ask your question live. And in the meantime, I know Theresa, you're on. I don't know if you have anything else to add or if you're good.
I think I'm good, and thank you for the presentation, both you, Elizabeth, and Dr. Medeiros, and Martha, as always, for championing us through this. Please do feel free to reach out to me if you need a refresher for a course on this, or if you know someone else who'd like to set up a training like this. I'm happy to help make that happen.
Thank you, Theresa. And as I mentioned, I am going to follow up later on via email. So you will get links to the recordings in both English and Spanish. You will get links to the evaluations, again, in both English and Spanish. And you will get PDF copies of this presentation. And any links on that PDF copies will be live and will take you to wherever you need to go. And I don't see any questions that have come in. So I'm going to assume you guys don't have questions. So I'll give you guys 8 minutes back of your day. But yes, thank you very much for being here. Thank you again to Dr. Medeiros, to Elizabeth Gonzalez Ibarra, Theresa, and to our interpreters, to Roxana for helping me with the Spanish portion of this webinar. Thank you all, and I hope to see you again next time. Bye, everybody.
Okay. Bye-bye.